We're presenting here the results of our phase 1 trial of a CD22-targeted CAR-T cell product for a population of patients with very highly refractory CD19-negative relapse following prior CD19-directed therapy. So we know that these patients are extremely high risk. Patients who relapse following CAR-19 with CD19 antigen loss have extremely poor survival, with a median overall survival of less than 10 months from the time of their relapse. And so there's really a very urgent need to develop novel therapies for these patients. So we developed a novel CAR construct termed CAR-22-65S and administered that in a phase 1 trial. We had a total of 20 patients screened, 19 enrolled and 17 ultimately infused, and all 17 of those were evaluable for response. And we were really excited to see really high complete response rates. So 77% of patients entered a CR at day 28. And again, these are patients with extremely limited therapeutic options. Following initial response, however, we do see a lot of patients go on to subsequently relapse, especially if they did not follow CAR-22 therapy with a consolidative transplant, if they were just using CAR-22 as definitive therapy. Although we do have one patient who did receive CAR-22 just as definitive therapy and is in a long-term remission from that. But we do have some patients who went on to consolidative transplant who stayed in long-term remissions. I think the other piece of the study that we were really excited and gratified by was the safety profile. These were patients who, again, really highly refractory, and most of them came into CAR-T with very high disease burden, which we know is the #1 predictor of having severe toxicity after CAR-T cell products. But despite very high disease burden, we actually, in the initial infusion setting, didn't see any grade 3 or 4 cytokine release syndrome or ICANS. We only saw grade 1 and 2. And so really a nice, tolerable safety profile, knowing that this is a potential therapeutic option for patients with really limited therapeutic options. And then I think the other big takeaway from this is we know, again, seeing some later relapses after that first remission that you get with CAR-22, I think really highlights the need to use CAR-22 as part of combination therapy, not just on its own. So whether that's in combination with transplant, like many patients on this study use, or in combination with a CAR-19 product as a dual targeted CAR, and that's where we're very excited to go to next with this data.